So these are the things. Second thing is the weight loss. Weight loss. And then they come and sit.
A lot of overweight patients, is it?
Yeah, overweight, always I target myself to push them to lose. I do that a lot. Overweight, I make sure that they come there, I push them, I give individual attention. I'll see them in 10 days time. Just see them, no consultation. I do that. Because once I target, to lose his weight, to make sure that he comes to normal, I take their word first. I said, okay, I'm going to help you, but will you be with me? Right? Will you be with me? Don't worry about charges. You are sailing in a bocho, the boat, which is
like repairing
boat, like bocho punya boat lah. Air dah naik dah, tanah. Mungkin dah tak boleh hidup lagi lah. Kalau you leave it, you're going to end up in trouble. So this is the time to lose weight. Would you want to do that? Okay, doctor. So motivation, I get their what do you call their agreement, or they say, I would put it this way, not agreement, their commitment. Totally committed, yes. So 10 days you have to be here, and they'll be there.
Okay.
Measure your weight now. How much you lost? Doctor, 3 kg lost. Yes, come. What have you done? Okay, push a little bit more.
Okay.
So keep on pushing, push.
So what do you actually ask them to do?
Same exercise, doctor. Cut down the diet. Alright, see, I don't focus on carbohydrate too much. There are a lot of controversies now in Australia recently. A doctor advised on the carbohydrate issue, right? You should not take too much of carbohydrate and all this thing.
Okay.
That is another issue. New Zealand, there's another case came up. A man was treating eczema. Alright, I just read yesterday. And this man is being penalized for giving diet advice, which is inappropriate. Right? Tomato, and he was advising not to consume tomato, all kind of nuts, dairy product, right? Anything sweet, basically, right? To get rid of eczema. And he was using his own cocktail, fungal cream and also steroid cream, combination of this thing. Alright? Actually, that's what I've been doing here.
But the cream, what?
Yeah, sure. You need water, right?
I'm okay. Sorry.
Stop it for a while, then. I'll get you some water. Tak boleh. Berhenti.
Yeah, just now we're talking about the doctor in New Zealand who...
Yeah, there was a doctor in New Zealand, just recently yesterday. He treated all his patients, about 70,000 patients with eczema. Terrible eczema, seen by pediatrician, a lot of people. And basically they're given a hope, or maybe they have to keep on seeing the patient over the period of time with no resolution. So this gentleman, he proposed a theory, and he did some kind of a scientific research on himself, basically by himself, and then found that these are the diets which are responsible for you to trigger the allergic reaction. And he made sure that they don't take all this thing, all the diets I put. Subsequently, put them on antifungal in combination with steroid cream. They are alright in about a couple of weeks. And now the whole New Zealand medical board is coming against him, saying you are not doing the right thing, it's unethical, blah blah.
Because I was wondering the connection between that antifungal cream and so on with the diet.
Okay, very simple here, doctor. This is what we do here also. It's not only in New Zealand, we are doing it here.
Okay.
Now see, anything to do with sugar and dairy product, they are going to disrupt the intestine, which I told you earlier. They are going to call a condition called as leaky gut syndrome. Okay, that means you consume your milk or anything sweet, it goes down to the intestine. Sweet, we leave it alone. Other things like nuts, like tomato, right? All these things are going down, definitely going down to the colon and all the small and large intestine. They are going to cause sensitization, or they're going to, I would say, they destroy the lining of the intestines.
Okay.
When these particles, the antigen from this food product, enters into the circulation, they get antigen and antibody reaction with it. And the immunological basis of most of the diseases starts from the bowel. Alright, so that's the reason why you took out all the drugs. Okay, of course we know nuts. Yeah, legit. Are they absorbed into the stomach? Definitely not. Absorption is after that, right?
Yeah.
Okay. So once absorbed, the antigen, it's a normal absorption. When it goes to other part, larger intestine, supposed to be absorbed from water. Right? So somehow or rather, these particles are not supposed to be absorbed. Right? So, okay, if you're allergic to nuts, of course you should avoid that. And this gentleman, what he did, he avoided all this diet.
Okay.
And then he gave the person steroid in combination with fungal cream. Right?
Just a cream.
Just a cream. That's all. They're fine. Very simple. Prolonged eczema, you'll have fungal orientation, fungal infiltration. Definitely you'll have. So you combine steroid and fungus. That's all. Here we do a little bit better. I mean, I would say we do in a different way. We use a very minimal steroid.
Okay.
Of course, high potent steroid like Dermowit, 0.05%. In it's not cream we use ointment. It sticks for a longer time. But I just use in 1 ounce. I just use quarter ounce, right? Because my focus on fungal infection. See, if it were to be fungus, it's going to cause something, a condition called tinea incognito. A redden, fungal infection. So my concern is to treat eczema, right? So now to treat eczema, of course, the steroid is the most important thing. Outside there, they say beta-methoxone, valerate, blah blah blah. Less potent steroid, low potent. So what I do is I dilute my more potent steroid, dilutional effect. So I take the highest potency, super potent, take only 1/4 and dilute it with aqueous cream. All right, and add in some urea cream. Urea will absorb moisture. Urea will reduce the itchiness, and aqueous cream will give the moisturizing effect. A little bit of steroid, so that works better.
Okay, so
right.
That's for the eczema.
That's for the eczema. If I suspect there could be prolonged chronic eczema, and you can see fungal infiltration, you can see, fungus you can see, not the hype of course. You can see whether it is infected with fungus or not. Then we add in fungal cream along with the. I don't combine with the steroid cream.
Okay.
I avoid doing that separately. I tell them to apply this in the morning. I tell them to apply the other one. So this is how we approach.
Okay. And the diet also.
Diet definitely will advise them.
Avoid nuts.
Avoid dairy product. Anything sweet, chocolate, obviously we take it out first. And after that we introduce back to the hand. What this gentleman has done. Avoid, don't take for life. Come on, we are human beings, we have to eat. Let's say, okay, semua sudah baik, tak apa. Bagi dia makan ini lah. You give them to take this lah, but don't go for the other one. Wait first. So slowly we sensitize the body. Right? We sensitize the body slowly. Introduce. So no problem, right? Okay, cantik. You take this for about a month or two. If they happen to have eczema again, that means the product is offending. Right? So you don't take it lah. Avoid it lah. If you don't get it, then it's your product. You can eat it. So the technique is slowly sensitize the body. That's what we do here. So that's a way I think.
I was puzzled about you said that doctor in New Zealand, the patient died of...
No, but those cases are terrible cases. You can see, it's terrible, I tell you. People won't touch the cases.
Okay.
Huge, terrible children.
So it's a severe kind of
oh my God,
already.
You should see that. I'll share it with you later. It's a beautiful case. I really appreciate this guy. He has gone beyond the level and managed to cure about 70,000 patients a day. I think why can't you appreciate such doctors? End of the day, the care is for the patient, right? Whichever way doctors see, we are trained in the toughest course in the world. We are trained to think in the toughest manner, doing the GPs. Alright, we are trained, medical MBBS is not a small degree. We study from top to bottom. Why we have to be controlled by the superiors? By doing some analytical studies and all those things. And most of the studies are done in abroad. How many studies are done locally? Have we done randomized control trial here? Hardly, very few. So with whatever they studied there, whatever they studied among the white population, we try to employ here, which is not fair. Unless and until our KKM comes out, more studies being done. And again, another issue is ethnic group, Malaysia. Type of food that the Malay community consumes is different from what food Indian consumes. And what food the Chinese consume. These are the things that we have to evaluate first.
So is that why you feel that you have to be a guinea pig first?
That is that one part for my health sake as well. And then if I want to give you treatment, I should be satisfied. If I want to give you a hormone, I should make sure that hormone works. I should feel how I feel, and you should feel the same.
So you should have the experience.
The experience, yes. Experience, doctor. Unless you chocho, you won't know how painful it is. That's why last time I did some Botox on my face.
Oh, okay.
Botox, just over here. Just chocho, it's very painful.
You did yourself?
I did myself. Even blood, I take myself last.
Oh, right.
So that's why when I chocho a patient here, they don't feel any pain. They say, wah doktor tak ada rasa, dah cocok ke doktor? Because I make sure the needle is kept properly, the quick, immediate, quick, fast lah. It is not like ask them to, like for example, for injection purpose, they're giving intramuscular, right? You're going to give a buttock injection lah. The most important thing, you mix it properly, fine, and then locate the right position, place lah. That's important, right? You can't be choking all the part. There's a place to choke, right, in the buttock lah. So you prepare the place, prepare it, and then you hold the site which you're going to inject, and the technique of injection. Some doctors are always used to this. This is very difficult position over there. You have to adjust, and it's difficult. But people have been taught like that. So why can't hold it like that? Much easier.
Like a pen.
Yeah, like a pen. So, but again, you tickle over the side. Not tickle, you just give pressure, exert the pressure over the other side of the skin. Like you hold it, you divert the mind. Just press it a bit. So your focus will be over these two fingers. Then you go pop, masuk cepat. Jangan nak masuk slowly macam tu. Ini bukan apa. Pop. When it goes in, they just have to pass the thin layer of sensitive skin. Inside it's not painful. Then withdraw and save blood. And then when you inject slowly, but while exerting a little bit of pressure. Give some gap here. So their focus is going to be on these two and not here. And then take out quickly. Rub it. They'll never feel any pain.
Okay.
So
you tried that on...
I try myself.
I can't imagine doing on yourself.
No, I've done my injection over here.
On the deltoid?
Yes, a deltoid injection. I ask my staff to hold it, lift it up. Pop, I inject it.
And you do
I do it, yes.
The botox?
Botox very painful, doctor. Because
you do on your forehead?
Oh, my full forehead, yes.
So is it in front of a mirror?
Yeah, the mirror is here. We have a mirror there.
Okay.
So just go there. I applied all the cream, of course. Put ice pack and everything. And then I just, still painful.
Okay, so you, in a way, you understand how the patient feels.
Yes. So now if you come to Botox, if people want Botox and it's painful, I'll try to make it painful, less painful. Give them a bit of Voltron, nice local anesthesia, alright? Nice ice pack, direction of the injection, very quickly you have to pop, before they get water coming out. So and Branura I put myself as well. Branura. I do a bit of IV vitamin therapy for my patients. And now currently I have some patients for stroke rehabilitation.
Okay.
Right. So stroke is nothing but what they do, diagnosis, correction of the comorbidities.
Okay, so they are already discharged from the hospital.
Now they are having the
deformity.
Lah. Now how are you going to correct it? Right? So we use a little bit of diet, vaccine as I told you. If there's a need for a hormone, we use hormone.
Okay, so you check the hormones also?
Yes. Depends, doctor. Again, depends, because people when they have high BP and all this, you have to be very careful. Because hormones can also trigger blood pressure slightly. Can get thyroid. So be careful. Or these hormones are much better lah. So not for all the hormones lah. I mean, not for all the stroke patient I put in hormone, but I would consider giving them more supplements.
Okay.
I use a lot of supplements for them.
Right? So that's where it comes, the IV vitamin.
No, oral vitamin first.
Oral vitamins.
If they can afford, I go for IV vitamin.
What kind of vitamin are you?
I use glutathione. It's amino acid number 16, antioxidant, along with our usual parentovide, which is a German product. It's approved by the KKM, right? Okay. So we use those things, and B complex. Just give it to them. Parkinson disease. The moment you put glutathione, the tremor stops immediately. Right. Immediately after that, you give them oral glutathione. They are much well controlled Parkinson's. Of course, you have to continue with the power. You have to continue with that, but the symptoms are much better. I use IV vitamin C, which I import straight from US. These are things I don't mind sharing lah, because these are very confidential. I know it's KKM is a sensitive issue, but I'm using it only for my patient. I don't use it for cosmetic purpose. I'm using for old ladies, old people who need to be rehabilitated.
Stroke patients.
Stroke patient particularly, and they perform fantastic. Fantastic. I have a patient of my high-end patient lah. Okay, I would say it's confidential, but I'll let you know lah. He's one of the richest men in Malaysia. Okay. Right. Very nice man. Tan Sri. He had so he owns highway lah. Right. Okay. So a friend of mine introduced me to him. Apparently he was in UK and he was in Russia, in Australia and US, all these places going for this peripheral arterial disease. severe disease, and some of the vessels are 100% blocked. 100% blocked. I have some of the photos here.
Okay.
Right. So, and I was introducing, and he was using some kind of therapy. They said, no, like you can't do anything on that. Some people even thought, okay, you can do a bypass. All this kind of, without complication, right? So some people said, no, don't do a bypass. You'll end up in trouble because you may lose your limb. So finally, I was introduced. I did detox. I did everything. A man who can walk only 30 meters, ended up walking 5 kilometers. Right? I'm not boasting myself. But there's something else.
So,
of course, I brought in another friend of mine for physiotherapy.
So in a way, his function drastically improved.
Improved. Okay. For that I had to. This is the first chelation therapy I did for him. Chelation, EVTA.
Okay.
Right. Okay. These are all not to be mentioned here. But I'm telling you, is it okay? Fine, no problem, right?
We don't mention any names or things like that.
So there's a chelation, only person I did. And chelation therapy in diabetes was fantastic. They form collateral so well. And this person something has to be done for him. After 30 meters, painful. You can imagine that. So very nice, loving guy, lovely guy, very nice man. Very nice man. I'm still friendly with him. Right? So these are the things when you feel like, potentially I'll do something for you. Right? And then he took all the medicine, threw it down. We met one of the cardiologists there who also did IV vitamin from Bangsa. IV vitamin from Selayang.
The IV vitamin is glutathione also?
No, vitamin C.
Vitamin C.
Cocktail, doctor.
Okay.
Right? I give it to my mother.
Your mother?
Yes, I've taken it myself. I give it to my wife.
Okay.
Because I import it myself.
Your mother and your wife suffered from anything?
Nothing, doctor. My mother is 73 now. Alright, 73 old. She's on hormone, she's on supplement, all those things. That's why she's doing well.
Oh, okay.
Right, no
so
problem.
she has no
Nothing,
medical illness?
no medical illness. Diabetes is there, but always 5.3, 6,
so
only with supplement.
control.
And also diet she's controlling, only walking she does. Right, from now and then I put on vitamins.
Okay.
Right, I think I'm doing justice for other patients.
So meaning like for certain patients, it's also being given for general health or for prevention?
I wouldn't want them to start on any supplement unless you do a detoxification.
So that's the first step.
First step is detoxification. You know why? We have loads of fungal infection which we are not sure about. When the vagina can have white discharge over there, you can always imagine your colon can have such a problem. And scientifically they have done a scope and found a lot of patches of candidiasis. Now with the candidiasis you get bloating sensation, indigestion,
in the colon,
indigestion, itchiness, rashes, eczema, asthma, all these things, these are part of it. So you have to get rid of it first. Okay, ask them not to take too much sugar. Don't touch sugar for 1 week. Avoid fruits. Because you're going to treat, and the candida, the fungus, they depend on sugary stuff, the milk, dairy product. So avoid that for 1 week. Give them chicken or fish or whatever, vegetable, and a little bit of rice is fine. So give them the cocktail of our antifungal treatment for 5 days. After 5 days, you can see their tongue become red, not white coated anymore. Alright? You see, those who are discharged from hospital, there's so much of antibiotic. Who cares to treat for the side effect of bacteria, the side effect of antibiotic, right? Broad spectrum antibiotic being banned. Do they bother about treating the patient with the fungal infection? You can see tongue can get fungal infection. Don't you think the colon cannot get? The intestine cannot get? What if the fungus is there? They are the toxins. They are going to release toxins. What's going to happen to the body?
So that's why first step is
First step is dysbiosis. Right? Once you do this dysbiosis, the stomach will become much better.
Symbiosis. Dysbiosis.
So dysbiosis, bio means bio products. You're taking it away.
That is taking
it away.
You take a certain
we take
substance.
We can cocktail of antifungals.
Okay.
Cocktail of antifungal for 5 days. No harm, nothing.
Okay, so that's detox.
Detox. We call it detox. But the best word to call it dysbiosis. Bowel first. Then you give them any amount of supplement, they will be readily absorbed. Otherwise, when they are not absorbed, this thing will remain in the stomach, in your bowel, as toxin, product of toxin, because they are vitamins. Right?
Okay.
You have to be very careful with that. You cannot have chronic constipation. End of the day, what you notice is chronic constipation, you end up in colon cancer. By the contact period. Same thing, you don't allow any medicine to stay there for a long time. Invariably, when you give a chronic constipation patient diabetes because of the peripheral neuropathy, okay, autonomic dysfunction, they are getting constipation. You check one day, they'll have some cancer. Contact period. These are something which has to come out regularly.
Okay.
Yeah, that's why, this important part.
Yeah, because just now I was wondering, you were mentioning that stroke patient, you gave the vitamins and so on, but your mother does not have stroke. So is it for prevention?
Prevention. She did have a sciatica recently. Right. See, the problem was I made a mistake not to buy a nice couch. Normally, you need a chair to sit comfort. Posture is important. So she was sitting. Of course, I bought a nice bed. Jampu of bed. It's quite nice. You can take your posture. That's a nice. You should consider to buy. For the old people, it's always good to have something which maintain your spinal shape of the spine. The rest of the beds, there will be a elevation, depression, pain there, pain here. So what I did, I bought this bed for about, I think 15 years ago, 10-15 years ago. I bought a bed which just sinks inside. When you get up, it comes back into the chair. So the buttock goes in, the shoulder goes in, the spine is maintained. But what she did, she went and sat on the chair with the leg like that, watching TV. Causing direct compression on the buttock towards the sciatica. It's like having a purse in the back. So I told her why you're sitting there. No problem. She gave a lot of it. So no reason. I brought her here, put a drink. And then I had to use a steroid injection because the compression once happened with her, it's quite difficult to, difficult to correct. Physiotherapy for sciatica, tell me which case has been, maybe one or two become successful. So you have to identify the place. It's either lumbosacral. And again, she developed the lumbar spondylosis. The reason being the posture, hunching back. So you have to tell them what kind of posture you sit. Are you supposed to sit on the bed? You have to put down your leg. And then after that, I did a massage here. I do a bit of massaging also. I learned from Chinese inside. So over the sciatic point there. So sciatic point, the piriformis muscle there. Origin muscle, that is where the sciatic muscle, sciatic nerve comes out.
The Chinese sensei also.
And they don't know that much. It's common sense lah. Like we see the anatomy. Where it comes in, where's the flow? Okay, right. The nerves come in, there are 5 branches. And then there's no problem. Lumbar region, sacrum is alright. Where's the another next compression? You press it there lah. You have the tenderness there. That means the compression is there. Right? Impact is over there. Then press the other side. It comes here at the bottom here. So just press and see. Okay, fine. Jab, diluted steroid. Right? Local say, Amma, how do you feel? No more pain. Psychologically they're better. Then teach them the sciatic exercise. But the one can say, okay, she's all right now. So that's how we do it.
And you mentioned for prevention the
sitting.
The vitamins just now.
Yes.
Is it prevention of stroke or?
No, not prevention of stroke, doctor. It is a prevention of whatever she has been taking those days. We don't know what she takes. But vitamin C is an antioxidant. Vitamins is antivirus, antibacterial.
So whatever food that she has been taking.
Yeah, even for the body, for example, she's diabetic. It can have an impact on the endothelium. And on endothelium, you need vitamin C. Right or not? So you take prevention. Formation of bone, you need vitamin C. Ligaments, you need vitamin C. Teeth, hair, everything needs vitamin C. We don't produce in our body like the other animals, right? For example, in New Zealand, they have accepted vitamin C as a main treatment in the ICU for swine flu. Right? So we have not considered that. Why can't we do a research on that? And regularize them. Regularize them. Now the problem is I don't trust any of the first because most of the vitamin C are directly coming from China. So we are scared about that. Actually, when I was buying earlier, this was from China. People sold me. My mentor himself, right? He sold me. He said, don't worry, this is a good vitamin. I'm using it. Then I didn't feel nice about that, like, hey, the patient you get a better one, right? I said, then I called up, US, the Vitamin C Foundation US. Then I bought it straight. Of course, mine was held up a couple of times. Right? And it's a nice stuff, lah. I'll show it to you. It's just a powder form. Nice packing. You have to, just put it in a syringe and keep it in the refrigerator. And you get high quality, good vitamin. I don't mix up the other things.
So it sounds like it's more of because it prevents from cellular level.
Yes, it prevents
the diseases. Okay. And you are using it also?
Yes. You want, I can show it to you now.
The detox also you
Yes, doctor. We combine and then we'll happily using it. No
Okay.
problem with any problem, right?
Actually, where do you hear about this detox and so on? Where is?
Our society, Saham Society, we are in anti-aging.
Oh,
So we keep learning about that. Keep learning and see the patient, do it on us. We don't do it like and we read a lot of articles. Basically a lot of we have integrated group in our this thing. So we just a lot of people are very experienced guys.
So yeah, like a group.
A group, yes. So they will share certain things. And recently we've been discussing about pinology lah.
Okay, is a journal article, is it?
It's not journal article. Some of the experienced people, doctor, they are there from India, from here. These are the pioneers like that field lah. But being a GP, you have to have a win-win lah. You have to be win-win situation. You cannot be say, pinology, I'm going to do that and learn about that and try to. No, not necessary. You should balance it out. Hormone, you should balance it out. Diet, if it says 100,000 milligrams, you should know balance it out according to the body weight. Hormones, you have to balance it out. Exercise, you have to balance it out. Physical, mental health, you have to balance it out. Every case a unique case. You have to think about the uniqueness of every case. Otherwise, you cannot. Seriously, I'm not for the sake of talking and doing it, but I feel like that every patient differs. It's not like routine. What's that? We call it. This is a guideline. This is a guideline. You have to follow the guideline. For example, I can ask you, what is the first treatment guideline for the hypertension? It's amlodipine, calcium channel blocker, or HbA, what do you call that? ACE inhibitor. What if the patient has got anxiety disorder? Are we still going to give this? You might consider it. You beta blocker. It reduces anxiety as well. So where are we now? Are we following the guideline? The common sense guideline.
Okay.
Right. So this is what a GP should have.
Should have the common sense guideline to guide.
Correct. And people, our GPs and some of our colleagues say, oh no, that is not a practice. Fine. I'm not happy with what I've read. I'm not happy with what I've read in FMS, family medicine, the fast GP. I'm happy completing the thing and having the system learned properly. Of course, I need the system. But then, if you talk about the treatment part, I will definitely combine both aspects. Combine reasonably with my ability to gauge whether it is right.
Combine both.
Combine, yes. You need to combine both.
And then particular parts which you are not happy, or which make you not happy.
Okay, not happy means do not condemn the integrated medicine. Vitamin C doesn't work. Glutathione doesn't work. These are bogus. These are bullshit.
So that's the part.
You don't do any studies. You've been talking and talking. But all the countries are improving in terms of treatment care and treatment. New Zealand introduces vitamin C. Some other countries using this glutathione. All these countries are much better than our medical stuff. We are struggling even for the primary care sector. Right? We are having so much of problem in primary care. And there's a problem always between the GP, private sector and the government sector. All these when things are there, you can't even handle this. How can you go and say this is not workable, this is not right, this is bogus? But people work. GP are dwindling, doctor. They're going down just because of the government policies. Right? Try to correct that. Integrate. You have to integrate GP private practice with the government. Government FMS are there. Give them a place to see all the scrutinize all the cases. Under them, put the animals who also are in a process of learning FMS. So that's how the GP should be. Let the GP take over, and then make sure every month you have to complete some modules in the computer, whatever, and accumulate the point. Can go even to 100 points. No need to be CPD 20 points, right? And they have to. If you want to do circumcision, you have to attend this particular course. Then you can charge a proper way, right? So bringing GP into the system, right? That is when you can really think about having a national aim being achieved. And then don't put aside on integrated medicine. These are the people who come in with alternatives which are not achievable with no. How many cancer cases are cured with the chemotherapy? There are many people who die. Right? For them, 5-year survival is such a great thing. Right? Try to combine with other aspect of treatment. Make it 10 years. That's why as a whole I feel patients should be approached.
So it's like taking the positive parts.
The positive part. Plenty of positive thing around us. We don't shut our eyes. So this is the case I told you. This is the Tan Sri. He was in Wellington Hospital actually. Right? Okay? You see, what is the percentage of block here? You can see the whole limb is blocked up to here.
Okay.
This is 100% completely. 50% over there. This region here.
Yeah.
That's
bad.
Terrible, doctor. This is what you have to do. You cannot remove it. You have to do a bypass. Where to take the vessel so for so? You have to do something. And when this is blocked, do you have any collaterals automatically? Yes, there are collaterals formed. But are they sufficient enough to form the circulation? If there's sufficient circulation is formed, they won't have claudication pain.